Hello, everyone. My name is Yannicka Olson, and I'm a part of the Skoll Foundation team. I'm excited to welcome you to this Skoll World Forum session, Countering the Infodemic, Fighting Fake News During COVID-19. This year, the forum's theme is Closing the Distance. We thought there was no better way to reflect that theme than to invite our global design network to build a new kind of event together. I want to share a few quick notes before we begin. This session is being recorded and will be released publicly after the event. Please feel free to use the chat to engage with each other and ask questions of the speakers. This session is scheduled to end in 60 minutes. After the session, please take a few seconds to complete the single question feedback survey that we'll put in a poll here at the end of the session. On social media, we're using the hashtag SkollWF and would love for you to do the same. We're so thrilled to be able to include this session in this year's virtual Skoll World Forum and want to extend a special thank you to the Accountability Lab for proposing and designing it. With that, I'll turn this back over to you, Sherry.
Thank you so much, Janika, and thank you very much to the Skoll World Forum team for having us here. We are absolutely delighted to have this session on countering the infodemic this morning, and want to thank everyone who's jumped on to join us. Since we have lost a couple of minutes due to some technical challenges and gathering everyone here, I will keep my introduction short. Over the last few years, we've all been introduced to misinformation and fake news as it relates to elections, products, all kinds of things online. Unfortunately, when misinformation takes root during a pandemic, it can become not only a life and death situation when citizens need information on access to services, but it can also be a hindrance to accountability when funding is funneled into countries and there's no sense of how to hold governments and power holders to account around the services that citizens should be getting. Due to these compounded challenges, the Accountability Lab last year took it upon ourselves to see how we might use our existing networks and programs and tools to find a way to counter misinformation in the countries where it really mattered the most, and in spaces where people who were already marginalized could easily succumb to the dangers of misinformation. We used networks of local volunteers to gather rumors and pieces of misinformation on the ground and dispelled these using creative tools like infographics, radio programming, and all sorts of things that could really reach people beyond the digital divide and that could reach people who struggle with digital literacy. Because we can't take for granted that because someone is online, they have access to accurate information or that they have the tools in their skill set to discern between good and bad information. This was an incredibly interesting endeavor as it gave us so much insight into the types of misinformation that was circling around communities and how people were being affected by that on a daily basis. Many other actors across the globe found ways to counter misinformation over the last year. And I'm so delighted to bring together this morning a panel who can bring rich insights from a variety of countries and from working on this problem in different ways due to their positions. We have elected officials, we have people in the media space, and we also have a public health practitioner who understands this at the ground and at the health level. So without further ado, I would like to invite our first speaker up. And we're going to have a pretty simple flow this morning. Each of our speakers are going to have about 5 minutes to deliver some remarks based on their experience over the last year. And by the end of the session, we should be left with about 20 minutes for questions and answers. So I invite you to please go ahead and introduce yourself in the chat. Let's meet each other. We'd love to know who's in the room with us. We'd also love to hear from your experiences working on misinformation. So if you have any of your own, if you have any ideas to share, drop those in the chat. And also throughout the session, I invite you to drop your questions and comments for our panelists. And in our final 20 minutes, we'll do our best to address as many of those as we can. So without any further stalling, I would like to call up our first speaker, Ms. Sushila Bhatta, who serves currently as the Deputy Mayor of Dangadi City in Nepal. Sushila, could you please activate your camera and join us?
Greetings, everyone. I'm Susila. Now I'm started my presentation.
Go ahead. Thank you, Sushila.
It's okay. To begin with, I would like to briefly introduce you to Dhangadi sub-metropolitan city. It is the 10th biggest city in Nepal and shares an open border with India. I'm mentioning this because one of the biggest challenges that we faced as a sub-metropolitan office was to manage the migrant workers who were coming back from India with the virus spreading rapidly in India and migrant workers returning. There was a fear among the locals that Dhangadi would be one of the risky cities during the pandemic. At the such a point of time, we were able to manage sending 200,000 migrant workers to home safely by the coordinating with the holding centers across the country. Further, we also established 46 quarantines and 2 isolations to also provide spaces to migrant workers who could not reach their hometown for some time and had to stay with us. Additionally, we were also one of the first cities in the country to establish a female quarantine with all the additional facilities for the needs of the females. Until now, Dhangadi sub-metropolitan city has observed 2,616 infection cases and 19 deaths due to the COVID. Among many challenges faced to prevent and control COVID, one of the major challenges was the spreading rumors today. I will share some examples of the rumors and concerns that spread in our city and the approaches that we took handle to them. We became aware that a lot of women started giving childbirth at home thinking that it is safer than going to hospital. This raised different complications during their delivery. We then started an ambulance service just for pregnant women. We spread this news through different media sources. Many women then started using these ambulances and also going to hospital for childbirth. Similarly, there was a rumor that COVID is only a fake news. Our staff and elected bodies also went door to door, maintaining social distance to spread awareness during the pandemic. We also used different sources, including media, website, radio, requesting people to not to go behind such rumors and take required right actions, maintain social distance, wear masks, wash hands, and use sanitizers. There were other rumors, such as the vaccines were not useful. We vaccinated ourselves first to set an example and requested people falling in the priority list to vaccinate themselves as soon as possible. There are many other rumors around us, like the relief materials would not be distributed transparently, COVID would not kill anyone, or COVID would end the world. These are a very few examples of the rumors among many. We tried many approaches to handle many of those rumors, and I hope it shed some light on how information gap plays a critical role during a crisis. During the pandemic, Accountability Lab played an important role in decreasing the rumors. Decreasing the rumors. I would like I would like to thank Accountability Lab for their regular hard work and coordination. They created regular bulletins that help the public to get the right information. As a metropolitan city, we could not have done much without the support from different stakeholders, including CSOs and media. They have provided a lot of support to us, from building quarantines to managing relief and spreading awareness among the public. As a leader, I feel one of the keys to managing the pandemic is collaboration and everyone supporting with their strength wherever possible. Thank you.
Thank you so much for your remarks, Sushila, and for highlighting the very specific impact on your city, sharing an open border and having a constant flow of migrant workers. I can only imagine how stressful that becomes during a pandemic, and for also highlighting the multi-stakeholder approach that's really needed to work against misinformation during a pandemic. I'll now hand over to our next speaker, Gautam Raju. Thank you so much for joining us, Gautam. Gautam serves currently as the Managing Director for Purpose Europe.
Hi, everyone, and lovely to be here, and thank you to Skoll and to Accountability Lab for hosting this really engaging and interesting discussion that I'm sure everyone is wanting to contribute to. So I'll keep my my spiel short. For those of you who don't know, I work for an organization called Purpose. We're an organization that builds and supports social movements all around the world that are fighting for a more open, just and habitable world. And over the last year, we've partnered directly with the United Nations Secretary General's Office, where we've been running a campaign called Verified, which launched in around May last year, which is around combating misinformation on COVID-19. It was, it really started as a global campaign, deploying tactics around at a global level to figure out how we can combat misinformation and really quickly transition to national focuses and local focuses to reach vulnerable audiences that were being exposed to misinformation. Today, I'm going to talk about two interventions that we launched and bring those two interventions to the table around things that we learned and interesting insights that we had. The first intervention that I'm going to talk about is a campaign concept called Pause, Take Care Before You Share. The Pause campaign was built off research that we had found and in partnership with fact-checking experts around the world, and based off the concept of if we could get people to pause when they are exposed to a piece of misinformation, it can rapidly reduce the sharing of misinformation because it creates friction. And content is designed, like misinformation content from research is designed to, fuel an emotional rush when you share that piece of content. And if you can create just a 10-second or a 3 to 10 second pause when people are exposed to content, you can actually reduce the sharing of misinformation. And so we launched this campaign concept called Pause, hashtag Take Care Before You Share. That concept was then taken into national environments or local environments and sort of modified to reach those vulnerable audiences. And I'll give you a couple of examples how we did that. We partnered with Accountability Lab, where Accountability Lab generated songs and stories around using the pause messaging and the pause concept that was broadcast on community radio. Another kind of Africa folk and in Liberia and a bunch of other countries. The concept of pause was also taken up by MultiChoice Africa, a massive cable broadcaster there, where they were pushing pause content and working with local creatives across the continent to create and integrate pause into the content that they were creating, local creatives were creating, and then broadcast across their channels to start building this concept of, okay, let's just pause when we see and are exposed to a piece of sort of a compelling or an emotive piece of content. In India, we partnered with a bunch of hip hop artists and rappers who took the pause concept and turned it into a song, a pop song, which was then streamed on radio, which was turned into a YouTube video, and was kind of talking and referencing how misinformation is flying around, how it flows through peer-to-peer networks. That song then charted on Indian charts and has been a really effective tool in reaching a vulnerable audience that the government had identified of young people being really exposed to COVID misinformation. And so that was an incredibly useful tactic. The other kind of way that the pause messaging was also taken up, Hello Kitty took it up and was creating videos for the Southeast Asian audience around the concept of pause and getting their audiences to kind of pause and reflect. And I think what we learned through our interventions that were happening all around the world, taking this concept, is that bringing in non-traditional voices that has been a really effective way to reach some of these vulnerable voices who are being exposed to misinformation. And so that is a big learning and insight from our campaign over the last year, is that if we can bring in voices that don't usually speak about misinformation to promote some of these concepts that have been tested and tried, we can really reduce the level of misinformation. And we have a bunch of data, and I'm happy to share that data around how audience were reacting as those non-traditional audiences, non-traditional sort of influencers and actors were talking about messaging was influencing them. The last one I'll quickly talk about is, and this is, we continue to run the pause concept with the UN right now. We're also running another initiative called Team Halo, and Team Halo is around targeting misinformation around the vaccine, and it's a partnership with the vaccine, the institutes and the researchers that have been developing the vaccine, and now we're pivoting to focus on medical practitioners who are now sort of the advocates who are talking about the importance of getting vaccinated. And basically, what we do is we train them to tell and to dispel rumors on TikTok. And we work with them to create videos. Those videos are then kind of accelerated by the social media platforms. Those TikTok videos are then sort of translated for Facebook, Instagram, and now we're sort of moving to take those videos onto channels like community radio, where people who are not just digital can experience this and see this content. And that content is proving to be incredibly effective in building vaccine confidence in some of our vulnerable communities all around the world. And I also have some data points to share around that. If people are interested, I can share our lessons and our learnings. So you can see that content and online at teamhalo.org, and that's kind of our flagship kind of campaign around building vaccine confidence in some of the countries where the vaccine rollout is happening. And as we move into as the vaccine rolls out to other countries, we are then building up that concept and launching it nationally in other countries. So a kind of interesting way to tell the stories and to dispel common vaccine hesitancy, rumors, and misinformation that's spreading as well. That's all I've got to say. I won't say any more, but happy to take questions later in the session. Over back to you, Sherry.
Thank you so much, Gautam. I want to commend you for the concept of pause, because I often think when I see a piece of misinformation coming up on my own timeline, I often think that this person take a minute to look at the URL, for example, and it's such a simple thing. If we just pay a tiny bit more attention and create that friction, we could very well make better decisions about what we share. So I think that's an excellent approach. And also, thank you for highlighting almost following up on Susheila's multi-stakeholder approach. You highlighted a multi-platform approach, which is equally as important. People gather and find information in different stakeholders and in different arenas. And so there's no one place in which we can work against misinformation. We really have to be everywhere and working with everyone and playing to our strengths as organizations that way. I'd like to invite up our next speaker, Jeannie Burgold, who currently serves as the president and CEO of Internews. Jeannie, thank you so much for joining us.
Thank you, and really excited to be here on this really important topic. I am the president of Internews, Jeannie Burgold, and we are not a news organization, despite our names. We support news organizations in about 80 countries around the world and help them do a better job at communicating with their communities. So needless to say, our partners everywhere in the world have been focused on the COVID-19 pandemic over the last year. And I'll say we heard a lot about the rumors that are going around in the infodemic, and it really is wearing the world down. We are getting tired of this infodemic. A recent WHO survey of 25,000 young people found that 60% were overwhelmed by the amount of COVID information out there, and 50% of those have tuned out completely. So the infodemic is taking a devastating toll on our ability to fight the pandemic. And with the introduction of vaccines, it's getting all the more challenging. Vaccines are so personal and so sensitive and so controversial in themselves that the information challenges are just going and increasing significantly. In fact, we do some rumor tracking across 7 countries around the world, and we've seen an astonishing 6-fold increase in rumors as soon as the first clinical trials of vaccines were approved. That's how sensitive this topic is to people in the world. But I'm glad today that we're talking about solutions to this problem, and one that I'd like to go into a little bit of a country that's doing some really amazing work, which is India. So in April of 2020, the Indian Ministry of Health and Family Welfare released a COVID containment plan that included a really detailed information plan, had a mass communication strategy with SMS, social media, radio, television, had help desk, it had regular government press briefings. Concurrently, journalists across India played their role in translating the evolving science for a really health illiterate population. And so the most exciting part, though, that this information was amplified by a network of 2 million rural health workers who, again, were getting that message out there. And the results of this campaign in India were really clear. In November 2020, they conducted a national survey and found that 87% of Indians were willing to take the COVID-19 vaccine when it became available. That's all fantastic. In January, a little bit of a trouble hit. As the indigenously produced vaccines were being rolled out, the government used some confusing language. They talked about a clinical trial mode, and there was some mixed information about vaccine efficacy, which started to cause an uproar in the scientific community. And that uproar, needless to say, quickly moved into the popular media, and they started really covering stories that questioned the vaccine development and the approval process. So despite months of a really beautifully unified COVID-19 message, the uncoordinated and somewhat chaotic public introduction of the vaccines put the incredibly massive vaccine effort, perhaps the largest the world will ever see, at risk. So I don't want to end on a dark note with that story, because the good news is recently India has moved back from vaccine hesitancy to vaccine demand over the last 2 weeks. Part of it terribly is because of the rise in infections, but the medical community really took to the airwaves and 24/7 talking about the vaccines, talking about the resurgence in English and all the local languages, and they've really been able to bring India back on track, and the world should be grateful for that. But I think the case of India really reinforces a really hard lesson that building trust in such a sensitive issue as COVID-19 requires significant sustained work. But losing trust is sadly really, really simple. So we need to really think through the lessons about how we best communicate in the pandemic. And based on our work in 80 countries around the world, we have sort of our top 5 best lessons on communicating about COVID-19. The first lesson is that proximity matters. In most contexts, our research shows that the closer the sources of information is to the receiver, the greater the increase in trust. People trust their community health workers more than their ministries of health. People trust traditional medicine providers more than the WHO. Proximity matters. Second is that media matters. Health information campaigns that ignore the local vernacular media do so at their peril. We've learned this clearly in the HIV/AIDS crisis and Ebola response in Africa. Media has a role in translating the science information into colloquial conversation and in holding governments to account and ensuring transparency in the response. So second, media matters. Third is we can't simply replace rumors with facts. We need to listen. Two-way communication, community feedback loops help communicators better understand and respond to people's beliefs and get to the root of their fears. Those fears are where the rumors come from. The fears are where misinformation comes from. And so if we can do a better job listening, we can help lead people out of confusion and towards positive action. The fourth lesson is we need to reach people through channels they trust. We heard about going through multiple channels because everyone is somewhere else in the communication landscape. In Zimbabwe, a country where people really don't trust the government and really don't trust the state media, they needed to find a different way to get the public health messages out. So Kubatana, an organization many of you know, a human rights organization, experimented with sending pandemic messages out through their WhatsApp message, which is a platform that people really rely on in Zimbabwe. And Harvard University studied this effort and found that people who received this health message from a trusted source on a platform they use were 30% more willing to follow public health guidelines, despite the lack of trust in government. And our fifth recommendation, our final recommendation, is government communicators themselves need to be comfortable communicating uncertainty. Ignoring hot topics because we don't know the answer simply leads to unhealthy information vacuums, and those vacuums get filled with bad information. We found this in Mali very clearly when some health organizations were delayed conversations about the COVID-19 vaccine with journalists because public plans weren't in place. And this ultimately undermined immunization efforts across the board, including with other diseases such as polio. You need to be willing to tackle tough, hot topics, even if you don't have the information. You just need to clarify about those information gaps and when you think they could get filled. So with COVID, we are dealing with a very complex relationship between trust, influence, and behavior change. And with vaccines, we're at the center of perhaps the most consequential phase of the infodemic. And we need to deploy everything we can towards countering the misinformation and building the trust. So this panel is really important because we've got to learn these lessons and share these lessons and deploy them around the world. Thank you very much.
Jeannie, thank you so much for laying out the practical implications and especially things, you know, like around proximity. For example, I think myself how maybe on Facebook someone might pass up on a piece of misinformation they see on their timeline, but if it comes on your phone via WhatsApp and it's someone who's like this direct connection, they're a family member or a friend, that impact can often be so much more because there's that inherent trust through that relationship. I think there's just so many layers of this that we continue to have to unpack to find the ways to reach people. So thank you for that. I'd now like to call up our final speaker, Dr. Masoko Fala, who can share with us some interesting perspectives that bridge the gap between Ebola and the COVID-19 pandemic, based on his former role as the Director General of the National Public Health Institute of Liberia. And Dr. Fala also currently is the founder of Refuge Place International. Dr. Fala, thank you so much for joining us today.
Thank you very much. It's an opportunity to be here today to speak on infodemics in the context of COVID-19. We're fortunate to have been involved with the Ebola. And so being involved in the West African Ebola, we quickly realized the consequences of misinformation. And so that sort of informed some of the things we did once we decided to prepare for COVID-19. The first reality we had was the fact that whenever there is information vacuum, whenever there is an empty space, anything will fill it up. That's the first realization we had. And so the goal we tried to do when we were trying to prepare for COVID-19 and to manage the COVID-19 was to ensure we do not have a situation where there is massive information gap. The second thing we realized is the power of the media. We realized that the large part of the information gap that will be exploited will be by the media. You either work with the media and give them the right information, or some of the misinformation will fill the gap. And so one of the very earliest things we did as we prepared for the eventual arrival of COVID was to invite all of the media houses, the publishers and their key journalists to a meeting at the Public Institute to brainstorm on how we could manage information gap. And one journalist suggested something very innovative and said, Masoko, why not establish a WhatsApp group? And so that we are able to communicate in real time. Whenever we pick up any rumor, we'll let you guys know, and you guys can be able to respond in real time. And so that's what we did. We started a WhatsApp with all of the key media houses, both the print and electronic media. And that will come to help us over and over again because they will filter news and send them back to us. And then we'll try to quickly respond to those news and give the proper information to the media houses. So we had an approachment with the media. We had a friendly relationship. It was open, it was frank. And so we realized that no matter how bad the news was, we had to say the truth so that we could continue to build the trust of the media. And so that was the first thing we did. That was very important to fill the information gap for us to engage with the media houses through this innovation. We also employ a lot of social media. We remember Facebook was a major source of misinformation. And so we created a Facebook chat for Enfield, and we put real update, hourly update of cases, new rumor. Even if there was a rumor, we'll place it on Facebook. We had a team that would filter it and put it up, and then we gave the real information. And so having done that, we were able to actively get rumors. So we started doing rumor tracking. We had an entire team that were tracking rumors from the communities as they emanate from the community, either through the media houses, through social media. We'll be able to quickly dissect the rumor and then give the proper information. The way we got the information to the public was we had a weekly new press meeting with all the media houses. We have a press conference and we'll deal with those issues one at a time in the press conference. That will be followed by a press release. And so that kept on going. And then we had a simulcast that went on for almost 6 months. Basically, all of the major radio stations, including the rural radio stations, that we send news in the various languages, the vernaculars, we put news out in the different languages. And so that was this continuous engagement with the media, the public. That helped us a lot. And then the simulcast. Finally, we brought together major, talking about proximity to news. We went across, we brought in the superintendents, the head of religious group, we brought into a meeting and gave them orientation and training. And by diffusing the sort of people that were proximal to the population, they could pass on information to them and they could give us information. So in summary, engaging the media actively, innovation such as WhatsApp, making use of social media, weekly press conferences with press releases, and ensuring we fund those people that had the power for proximity. A combination of those things help us a lot to be able to stay on top of the game, to track cases, and to get rumor and treat them as it is and provide clarity. Those were some of the key lessons we learned as we prepare. And eventually, when COVID hit Liberia, those are some of the things we said and help us to go again ahead of the rumor and because of Ebola experiences. So thank you very much.
Thank you so much, Dr. Fala, and I want to commend you for the way in which you learned from the Ebola crisis and applied those lessons very well in Liberia during the COVID-19 pandemic. And also your references to proximity and again, religious leaders as well, and how it's really important that we get to the sources that community members trust. We now have a couple of minutes left, about 20, to hear from our speakers. So we already have a couple of questions that we're going to start asking of our panelists, but do feel free to continue dropping your questions and comments in the chat box. We'll keep gathering them there and asking them of our panelists. The first question we have, I'd like to ask of Jeannie, if you wouldn't mind. There was a question about how one balances out content with the realities people are facing, with specific reference to the vaccine rollout and currently also the discontinuation of a specific vaccine. So how do you balance, putting out good content with the ever-changing realities people are facing?
I mean, I guess that's the root of the challenge with COVID-19 is the science constantly changes, right? And so that's the reality. And we have to help media partners and government communicators live in that space. There is going to be fits and starts as we're facing right now, globally with some of the major vaccines. And so the ability to communicate uncertainty and sort of consistently say the science changes. Because the science changes, we're going to be talking about things as that science changes. And as people get used to the science changing, it will help. It will help as curves hit us when it comes to vaccine rollout. I'd like to, if you don't mind, just jump to sort of how to root some of this work into how people feel. And we talk a lot about fact checking, which is great, but we also think there's a really good reason to sort of do a reality check with that fact check. And so some of the simple tools that we help share with journalists, one is if you're reporting on things like the rise in death rates, a terrible topic, sort of to root that in the reality of people's lived experience by also looking at demand in local cemeteries. I mean, it's sort of, there's a connection between those two things. It helps reduce the uncertainty about that type of scientific data and make it very real and practical into people's lives. And so bring in fact checks, but bring those with reality checks that are rooted in people's lived experience. And as much as we can do that, as well as sort of communicating uncertainty, I think we'll make progress.
Thank you, Jeannie. We also found at the Accountability Lab that making stories as relatable as possible, especially in Nepal with dispelling rumors that were circling around migrant workers and so on, making it feel really, really relatable to people that these are stories they deal with, did help. I'm going to just give a second to see if any of our other panelists had something they wanted to add specifically on that question. Gautam, go.
Yeah, I think from our experience working in this space, what we've learned is that it's incredibly important to meet people where they're at, which kind of, and so when we're creating communications content that is around influencing or persuading audiences to change behaviors, is where are they at? And particularly when thinking about an online context, who are they listening to? How are they consuming that pieces of content? And what we found through the Team Halo work is that quick responses from trusted messengers is incredibly important and influential to responding to the ongoing changes and blood clots, vaccine rollout stops, and being able for those trusted messengers to be able to communicate in a very clear and concise way around what's actually happening and an engaging way is what we've definitely found is incredibly important. And they already have access to audiences as well. And so Team Halo is very built on that spirit of like meeting audiences where they're at, creating content that responds to the news cycle, and continuing making that content incredibly engaging and persuasive over a period of time, and also working within other channels and where communities are talking about this. So a big part of the Team Halo work is about getting medical influencers to connect with other influencers who have large reaches and getting to have conversations about vaccine hesitancy and some of the new things happening in the news cycle to sort of keep building confidence in some of the rollout that's happening around the world.
Thanks, Gautam. That does seem to require almost a 24-hour approach to keep up with the news cycle, which is a massive effort. And again, I think points to the fact that you need so many actors working on this to keep that alive and to stay up to date. I have a next question that came in for Sushila. Sushila, if you wouldn't mind joining us again, and I'll just read out this question. We'd like to hear from you, what kind of support do especially female leaders in government need from donors and partners to better work against misinformation?
Okay. Thank you, Sari. Now I request Asmita to translate my answer.
Okay.
Asmita, are you there?
Yes, ma'am, I'm here.
Okay. र अब नेपालका जो गभर्नमेन्टमा भएका महिलाहरू छन् उनीहरूलाई पनि केही कुराहरूको आवश्यकता त पर्छ नै, जुन यस्ता किसिमका गलतफहमीहरू फैलिराखेको हुन्छ, जसले गर्दाखेरि हामीले गरेको सही कामलाई पनि गलततिर गइराखेको पनि अवस्था रहन्छ। यसको लागि अब हामी त के सोचिरहेछौँ र हामीले धनगढी उपमहानगरपालिकाले पनि कस्तो किसिमको तयारी गरिराखेको छ भनेदेखि एउटा किसिमको त्यस्तो संयन्त्र बनोस् जसले यो यस्ता किसिमका र्युमरहरूलाई जहाँबाट उत्पन्न हुन्छ प्रड्युस हुन्छ यो र जसले त्यो कुरा सुनिरहा हुन्छन् र त्यसमा बग्छन् त्यो अफवाहमा उनीहरूको लागि बुझ्ने किसिमको मेकानिजम बनोस् त्यस्तो किसिमको संयन्त्र बनोस् र त्यस्तो क्षमतावान व्यक्तिहरू यहाँनिर हुन् भनेर पनि हामी काम गरिराखेका छौँ र मलाई लाग्छ नेपालका महिलाहरूको आवश्यकता पनि यही हो उहाँहरूको क्यापासिटी बिल्डिङको कुराहरू र जसले हाम्रा यस्ता किसिमका अफवाहहरूलाई म्यानेज गर्न सकुन् त्यस्ता किसिमका व्यक्तिहरू आफ्नो वरिपरि भन्नाले त्यो गभर्नमेन्ट भित्र राख्न सकिने अवस्था सृजना गर्न सक्नु नै यो लिडरहरूको आवश्यकता पनि त्यही हो र हामी नगरपालिकाले त्यो किसिमले काम पनि गरिराखेका छौँ प्लिज अस्मिता
Sure, thank you, ma'am. So I will be translating Susla ma'am's points. So she said that basically like Dangari sub-metropolitan city has been doing a different kind of like, you know, they have been developing a mechanism that listens, you know, like debunks the rumors and then listen to the rumors. So she wants like someone like, you know, like the human resource or the people who actually looks after those kind of rumors who will be helping Dangari sub-metropolitan city. And also she wants to, wants the support from the donors to convey the information that Dangari has been creating the authentic information to the grassroots of the community people and develop a support mechanism that bring government and people together and foster a proper communication. And also she wants to say that she wants the resources to collect the feedback from the government and from the grassroots. Yeah, thank you.
Thank you so much, Sushila, and thank you, Ashmita, for translating for us. And I think those points about needing human resources and other resources to be tracking these things and to work on these rumors connect well to what we've heard from all of our other speakers and the fact that this is an ongoing affair. There are new rumors popping up every day. And so you really do need people and you need resources to work on this. And I can imagine that in a municipality that has so many other demands on its time that attacking this new type of challenge places a lot of pressure on lawmakers and civil servants in that municipality. I have a couple of more questions that have come in. One for Dr. Fala, if you wouldn't mind taking this one, Dr. Fala. It would be interesting to hear a little bit more about how one can use religious leaders to counter misinformation. How can they use their platforms and teaching to push against misinformation?
Thank you very much. Like we said, the key is to work with them in their reality. We engage them, we sit with them, we listen, we ask to them, we ask them what are the thoughts, what are their own thoughts. So we always start by engaging them, find what's their thoughts about this issue of COVID, if it's vaccine, and we hear from them. Some of the times they have some partial information, we clarify the information, and we'll bring them on board as team members. And so all of our daily meetings we're having about planning for the response and all of that, the religious leader were represented. So they feel empowered, they feel they are part of the center for the decision. And so because of that, they are able to trickle that to their members. And we tried to be interreligious. We brought all religious groups together, whether it's the Muslim or the Christian, and give them equal power around the table. So we all sit around the table, listen to them, and they see for themselves, they report the true information. Because they feel that the key information that is going out, they are part of that decision-making process. They feel empowered. And so when they speak with certainty and authority as though they were part of the decision. It was not a top-down or a vertical approach. We all sat down and said, this is what the situation is, and we'll discuss it and allow them to let the information go through them to that favorite religious grouping. And so just that sense, bringing them to the center, understanding their reality, and then making them to be part of the messaging that we're going to give out. Help us to help them, and they help us in turn to give the proper information that will not distort it. Those are some of the key things we did.
Thank you so much, Dr. Fala. Do any of our other panelists, Shini or Gautam, do you have any experience working specifically with religious leaders?
I was going to jump in, not on religious leaders, but more on sort of public officials or celebrities. We actually had a very counterintuitive finding from our rumor tracking. Again, we're doing in about 7 countries around the world. We found a negative backlash when celebrities or well-known figures in a community talk about the fact that they've contracted COVID. There's like a weird uptick in social media, particularly by young people, about the hoax things, sort of that people just don't believe that COVID is real. And sort of for whatever reason, there's been a connection between public officials, government officials, celebrities announcing that they have COVID and the hoax themes. And so I think we need to track these things, right? To sort of see things that we just assume would help in an up, help people adopt good practices don't always work. And so that's sort of the other side of engaging sort of leaders in this type of campaign. And again, I don't know the whys for that. I just know that that's what we uncovered in our rumor tracking.
I'm sure there's going to be lots of learning that we all need to do at the end of this to figure out for the next time round how we work against this from the very beginning. Gautam, I wonder if you had anything to add to that.
Yeah, I think it's interesting, right? It's the way online communities are forming and the way that they're responding to this is really interesting, and it's like because they're particularly the anti-vax community, for example, or the COVID conspiracy theorists, they are so well mobilized. And so when there is a celebrity or a trusted messenger that posts something or talks about vaccine confidence, that because they're so mobilized within Facebook groups, WhatsApp groups, Telegram groups, they all kind of coordinate and respond quickly, and then we'll take that and we'll target people. We're seeing it a lot with our Team Halo workers, medical professionals and trusted messengers talk about the importance of the vaccine confidence. We see them be personally targeted by these far right communities. And I think the big gap that we have in the ecosystem is we need to have the same amount of agility from the institutions, from the governments, from the media, from civil society to be able to respond to this threat that is spiraling out of control. We also need the tech platforms to take greater action in moderating their platforms, taking down this content, spotting misinformation. And yes, they are taking the right steps, but we need them to move faster, and we need for them to take greater action. It's only just a few months ago that Facebook has actually committed to taking down some of these groups where, some of these like really toxic and really problematic communities are being incredibly effective, way more effective than we are in our comms communications. And so that's a big learning from our work.
Absolutely. The pace is incredible, and it feels sometimes like the tech platforms pace they're not keeping up with the demand for fighting this. I have 2 questions that I'm going to slightly mold into one, and this could be for any of our panelists. So there were 2 questions that came in around divides. Firstly, the rural-urban divide, how does that require a different sort of trend or tactics against misinformation, but also the age gap, because a lot of these platforms we're mentioning are primarily frequented by younger people, right? But how do we also reach the older generation? And do we need different approaches when we think about those generational gaps? And if you could also reflect on the rural-urban gaps that you've seen and how you've worked on those. I'll open the floor.
I'd say that Dr. Fala captured it so beautifully, I think, in describing his work in Liberia, because of, it is the multi-platform approach that you must take. And it gets back to that proximity issue. You need to go where people are, and the closer you are to the community you're trying to reach, the more effective your messaging. So if you're looking at urban and rural in a lot of countries around the world, you need to think about not just national broadcasters and national media, but getting at that community media level, getting at the community radio level for a number of countries, which also helps literacy issues as well. Likewise, and Gautam is going to be able to speak more to this, I mean, sort of the online communities versus offline. We do need to remember that there are offline communities, and particularly when it comes to the older generation, which are notoriously the worst when it comes to mis and disinformation and sharing mis and disinformation. And so sort of recognizing that age gap and recognizing that it is the older population that is in that mis and disinformation space in much worse than younger people. We need to address those things. But I think multi-platform, proximity, and really studying the behaviors of the age gaps makes a lot of sense.
Gautam, feel free to jump.
Yeah, I think there's something really interesting on with the older communities. It's definitely, you know, we know that misinformation spreads most rapidly and most effectively through peer-to-peer networks. So I just reflecting on my Indian family and the amount of misinformation my uncle sends me on a daily basis around vaccine confidence that goes around the family WhatsApp groups. And I think we, as part of the Pause campaign, we launched a bunch of targeted interventions using in India share chat, which is where kind of like the memes of India kind of exist on. And we started to try to flood share chat with pro-vaccine, pro social distancing, public health information memes to see if they would spread rapidly within the closed WhatsApp groups communities, where a lot of these rumors and a lot of the elderly community are like they're just forwarding lots of pieces of information to different groups. The issue with trying to track the effectiveness of that is that because WhatsApp is so closed and the API is not available to anyone, it was incredibly difficult for us to actually understand whether or not we were being persuasive. The only way that we could actually know if this was reaching people is that some of the WhatsApp messages or the content that we were creating and to influence audiences was coming back to us through other WhatsApp groups. So we know that it was going full circle in some ways through being forwarded. But yeah, I think that's something that is like incredibly important and a group that is obviously the most vulnerable, but one that is always never really targeted in interventions and approaches.
Absolutely. We have a couple of minutes left. Dr. Fala, I'm moving over to you for your thoughts on this question.
Okay. It's a new question. I want to address this. Basically, like Jen said, it has to be multi-channel. The thing we realize for Africa typically is that the rural population are more illiterate. They are more elderly. For several reasons, the young people come to the urban center for education, for better job. The rural population, you have to reach them ahead of time, because when they pull and misinformation, they are much more fixated to change the news, and I believe. So you really want to be ahead of the curve and reach them through proximity to power in their language and their dialect. You want to meet them ahead of time because it's so difficult to change their mind. The younger people in the urban centers, the more educated, they are much more vulnerable to Facebook, and they can move with the major thoughts and stuff. So like Jen said, it's a multi-pronged approach, multi-channel approach, trying to meet the rural people in their language. Proximity to power for them matters a lot. There's hierarchy, they believe in the hierarchy of power. If the chief tells them something, so you reach that group through proximity to power. The more urban, which are younger age group, because they come to the city for development, it's multi-pronged. Social media, education, intellectual appeal tend to work. So basically it's a mix of the two, and the timing is also very important. When do you reach the older people versus the young people? Yeah.
Thank you so much. We are just at the top of the hour, and I want to say a massive thank you to all of our speakers, bringing in your experiences from different countries, from different angles, that really spoke well, I think, to the multi-pronged approach that's needed to build trust, to meet people also where they are, and on a multitude of platforms and in different ways. Thank you to all of our attendees for joining us today and for participating in this very interesting conversation. And I hope that we can all do our bit to counter misinformation. Thank you very much.